Hi everybody and welcome to Ecophysiotherapy Presents Health, Wellness, and Lifestyle. My name is Madeline Golick. I'm the owner of Ecophysiotherapy as well as a pelvic health physiotherapist. And today we have Dr. Emily Lipinski back on the show. So welcome to the show.
Thank you.
I'm excited because we were sort of having a discussion earlier in the office about vitamin D, and I thought, what a perfect topic to actually record, for our guests.
Yes. Yes.
So today happens to be a lovely sunny day, but the winter time is definitely a time when people's vitamin D levels start to go down. What are some of the consequences of not having enough vitamin D?
So low levels of vitamin D have been linked to certain types of cancers. Specifically in women, there seems to be a link between low vitamin D and higher incidence of breast cancer.
Oh, okay.
Also, new research that came out the end of last year showed that there is a link between low vitamin D levels and higher rates of anxiety or depression, which is really important. It makes sense. When we are out in the sun, generally people feel a little bit better. Vitamin D is known as the sunshine vitamin, so it doesn't surprise me that low levels of vitamin D can correspond to lower moods as well.
Yeah, and it's interesting because, even after my pregnancy, I had followed up with my pelvic floor physiotherapist, and we were chatting about, how I was sort of holding tension in the pelvic floor, and then she was asking me about my vitamin D levels, because there seems to be research out there as well that not having enough vitamin D can result in muscular tension. But I wanted to talk about how much, because in sort of, the physiotherapy realm, or I've been told, it's about 1,000, what is it, UV, UI?
IU.
IU, okay, 1,000 IU. But now people are saying actually it should be 3,000 to 4,000 IU. How do you know how much you're actually supposed to be taking?
You have to test. You have to test your blood levels, and that's what's really important, because you can have too much vitamin D as well. So you don't, want to go out and get vitamin D and start taking a whole bunch every day, because it could increase your levels too high, and that can have side effects that no one wants.
Okay, what kind of side effects?
Well, vitamin D helps calcium get into the bones. So
Okay.
if you have too much vitamin D, you're forcing too much calcium into the bones, and it can change bone density. It can form bones.
Right. So if somebody if they have, in the physiotherapy realm, we'll say osteophyte, which is sort of like a little growth spurt.
Sure.
You definitely don't want to be having more of that, especially if it's around a nerve or something like that. Okay, interesting. I didn't know that.
And we don't also know what else that could happen at really, really high levels of vitamin D. Mm-hmm. So you want to make sure that you're having your blood levels tested and that your vitamin D levels are absolutely optimized. So right now in Canada, the lower level of vitamin D is around 74.
Okay.
But we know from research that optimal vitamin D is at least 140. Probably into 150 or have 160. So knowing that, you want to have supplementation accordingly, and it's also best to be under the care of a qualified healthcare provider to make sure that you're supplementing with the right dose and retesting your vitamin D to make sure you're falling into that optimal vitamin D level.
So when you go in for your annual physical with a doctor, are they testing vitamin D? Is that a standard practice?
Not in Ontario.
Okay.
Yeah, if you ask for it, they will, but it's not covered by OHIP. So that's something that you're going to be paying for out of pocket, whether you're paying for it through a naturopathic doctor or a medical doctor.
Okay, so either or, whether the doctor's testing it or a naturopath sending you off, you're paying for that test. But you're saying that testing it then helps you as the healthcare provider decide how much they need to take.
That's right. Yeah, first it will diagnose if you have an insufficient level of vitamin D or you're deficient in vitamin D, and then also just supplement accordingly. Of course, someone who's very, very deficient in vitamin D might need a bit more for a longer duration than someone that's maybe just slightly out of optimal dose. Maybe they would be fine with 1,000 IUs a day.
Right.
Yeah.
So in our brief discussion, you were talking about liquid vitamin D versus capsule vitamin D. Does it make a difference?
So vitamin D is fat-soluble vitamin, meaning that when you're taking vitamin D, you need to be taking it in a fat form. So there is vitamin D available on the market in tablet form that's not very well absorbed. I've had patients who have had deficient levels take the tablet form even at higher doses, and it hasn't moved their vitamin D levels in their blood that much because it's not in a fat.
Right.
So the best way to get it is through liquid vitamin D, and you can get that in gel caps, or you can get it in just the liquid dropper Ds, and you can a lot of people actually put it right onto their tongue, or they'll put it on their hand and lick it off so they know exactly how much they're getting per dose.
Right. And it's just coming to my mind because, when I did my prenatal follow-ups, they're asking, like, are you giving your daughter vitamin D? So
Yes.
why would that be important in, let's say, babies and young children?
So again, vitamin D helps with calcium absorption. We know
Okay.
that it also might help in growth and development with the baby. We're just kind of discovering now all the benefits that vitamin D has, and we know because we, as Canadians in Ontario, typically live inside for most of the winter, fall months. We're not getting exposed to vitamin D, and therefore the baby, through the mom, might not be getting enough vitamin D. And then once baby comes out, baby's not also exposed to the vitamin D out in the sun.
Right.
Probably as much as maybe our ancestors were. So the typical dose for babies and infants was 400 IUs. In Nordic countries, it's at 1,000 IUs, and that's being challenged. It's being challenged right now in deciding in Canada and North America, should that dose actually be a little higher, closer to 1,000 IUs for babies too, instead of the 400 IUs.
Right. Would it be wise to test for that, or
I don't think it's generally tested because, to take...
It's a baby, yeah.
And then risk versus benefit to take blood from a newborn, you have some risks.
Yeah. That makes sense. Okay.
So right now, we still generally follow the guidelines of 400 IU for the baby as per Health Canada, but that might be changing in the future, so definitely look out for that.
Okay, interesting.
I should mention the other way you can get vitamin D is through cod liver oil. Sometimes patients ask about that. In the cod liver oil, that's all vitamin D that we get in supplement form is synthetic, but in cod liver oil is the natural form. Some people want just the natural form of vitamin D, which you can get through cod liver oil, but again, that's typically used for adults or kids that are older, not infants and newborns, obviously.
Right. Okay. What else is important for us to know about vitamin D? I know that there's some debate happening now as to whether or not vitamin D is a hormone or is it actually a vitamin.
We don't know yet,
Yeah, okay.
But because it seems to have possible benefit in preventing hormone-dependent cancers. That's also, some of the interesting stuff that's coming up about, well, is vitamin D actually a hormone or has hormone-like properties to it? For as a woman, as she ages, for osteoporosis or osteopenia prevention, vitamin D is really, really important. Because, again, vitamin D helps the calcium get into the bones, as does magnesium and a few other minerals and nutrients like boron and vanadium. But previously, just calcium alone was given, but we know that too much calcium, it actually doesn't help get into the bones. It floats around in the blood, and then it can accumulate in parts that we don't want it, like the kidneys or the heart.
Right.
So especially as a woman ages, not just for overall health and wellness prevention, but also for osteopenia, osteoporosis prevention, which all women over the age of 50 should be on the lookout for.
Absolutely.
Vitamin D is really important there too.
Okay. Are there any other conditions or symptoms that that would warrant you to want to look at vitamin D levels?
Well, top of my list is anxiety and depression, for sure. Cancer prevention, including prostate cancer prevention in men. Osteoporosis, osteopenia. Vitamin D also has immune beneficial properties. It's very good for the immune system. So low levels of vitamin D can increase your chance of getting sick with the cold flu. So that's, someone that's constantly sick, has, chronic infections all the time, definitely want to look at vitamin D level status too. But I'd say that, everyone could probably benefit from having their vitamin D levels checked and then optimized.
Right. Yeah, because I mean, my family doctor, on an annual is like, oh, are you taking, vitamin D? And you should take vitamin D. But that was probably that was the extent of our conversation with respect to that. Are all vitamin D supplements created equal?
No supplements.
Okay. So I thought maybe we could talk about a little bit about, like, how do you select the right
supplement.
Yeah, whether it be, when you're thinking about brands, or again, you mentioned sort of gel versus tablet, but, what are you looking out for?
I generally don't, promote certain brands in public. It depends what's going to be best for the patient.
Yeah.
But in terms, again, I really avoid the tablet form because it's not going to be absorbable. You want to make sure that you're getting something that says fat soluble or emulsified. When it's especially the liquid drops, you want to see emulsified oil formula or emulsified vitamin D formula on there. Okay. And then, of course, if you're using vitamin D for, let's say, osteoporosis or osteopenia prevention, you also want to make sure you're getting some of those other vitamins and nutrients that are important to keep the bones healthy, like calcium, magnesium, boron, vanadium, right?
Right, okay.
That's probably the...
So when we're talking about, like, we're trying to address a specific problem, so we have, like, overall health, we want to optimize for our mood and things like that, but then when you're treating for a specific condition, you need to look at the whole picture as to what else may be necessary to address the issue. It's not just vitamin D.
Yeah.
Anything else that you think is important for people to know about vitamin D?
I think we covered most things. Obviously, in pregnancy, vitamin D is also really important. And I generally have women looking to conceive or during pregnancy also measure vitamin D levels to make sure those are optimized, because the infant in utero or the fetus in utero is going to get the vitamin D from the mom. And so that's also really important.
Is a prenatal supplement enough? Vitamin D?
Again, depends on your levels, but often no. And in the prenatal supplement, it's not fat soluble, right? So if you are taking the prenatal supplement with a meal, you might be absorbing a little bit more vitamin D, but you can generally say that most vitamin Ds in a prenatal supplement probably aren't going to give you a lot of vitamin D.
Right, because they're usually in a tablet.
That's right.
Tablet form, and they have everything
or powder
else.
Capsule.
Right. Okay. So they might not have the properties for it to be fat soluble for optimal
absorption.
Okay. Awesome. Well, I just, I found it interesting to talk about because we were chatting about the vitamin D, and I thought, well, if I have questions, then other people have questions.
Yes.
And the thing that struck me was the importance of, like, knowing where your levels
are
at, right? Rather than just going to, the vitamin store and just being like, well, I heard this, you should take this, and, you just start putting pill bottles into your checkout cart, right?
And how do you know if you even need it if you don't test it? And then I've had patients take vitamin D levels for years, and then once they test their vitamin D levels, they're so surprised to find out that they're still deficient in vitamin D because they've been taking 1/10 of what their body actually needs, right?
Right. Yeah. So I just wanted to give an opportunity to share that with our listeners so that they can make, more informed choice. And of course, if you're looking to find out if vitamin D is right for you and whether you should be taking other things, consulting a naturopathic doctor is very helpful in that case. Yeah. And so anything else that you can think of that might be important to say?
Probably not. Some people ask where to get vitamin D in the diet. As I mentioned, cod liver oil has the natural form of vitamin D in a higher dose. A lot of foods don't have a ton of vitamin D. Fish does have some vitamin D, but vitamin D is naturally best absorbed from the sun because of how our skin converts it. In the supplementation, it's a much higher dose than what you'd naturally find in any food. A lot of our foods, if you're trying to get it through food, it's actually too small of a dose typically to actually help to bump the vitamin D levels up.
Okay, let me ask this, because it just came to my mind. What about being out in the sun?
Yes.
How much time do we need to spend in the sun to I guess that would depend, but
It depends. Last time I checked the research for this, it was you had to be out there at least for 15 minutes.
okay.
But the issue is too, sunscreen, it looks like sunscreen blocks the absorption of vitamin D from our skin. So
Okay.
a lot of people do wear sunscreen for a lot of beneficial reasons. So again, I have patients that spend a lot of time outside in the sun in the summer. They use the sunscreen to protect their skin,
Yeah.
and they're still vitamin D deficient.
Okay, that might be something to consider
Yes.
because, it's like go outside for 15 minutes, but I had no idea that sunscreen could affect the
impede
absorption. So there's me like, well, yeah, but I'm outside, so
Right.
I don't need to supplement.
But you might. You
But
just
I
need-
might, yeah. But you need to test. You need to
test.
know where you're at. And of course, with any treatment, you sort of want to know if things are improving. So you kind of
Absolutely.
need a before
And
an after to make
Yeah.
sure that what you're doing is actually effective because benefits, risks, you always want to, you want to monitor change so that and it's money. It costs money to
Sure.
get supplements and stuff like that. So if you don't need it and you're getting it optimally through diet and being outside, again,
Yes.
you could be saving. Who doesn't want to save
That's
money, right?
Yeah. Oh, and actually, this just came to mind that because vitamin D helps the immune system, vitamin D is really important in autoimmune conditions. And low levels of vitamin D might also increase the chance of development of autoimmune conditions. So that's in someone that has autoimmune,
Or maybe family history.
The most common cause of hypothyroidism in our country is due to an autoimmune form called Hashimoto's thyroiditis. So you definitely, if you do have thyroid conditions, it's also important you test for vitamin D.
Awesome. Well, thank you so much for this impromptu discussion, but I was super interested. I'm like, we need to stop talking and start recording.
Sure.
So thanks again. And if anybody has questions, we'll have our contact info available at the end of the show. So thanks so much for listening. Take care. Bye.
Bye.